Hello all, I am Ms. Rajeshwari of Pediatric faculty. I welcome you all to KNO Academy. In this session, we are going to see high-yield important MCQs in pediatrics for exclusively NORCET, ESIC and RRB upcoming exams. Let's quickly move on to the session. So the first question here is the sequence of taking vital signs in a newborn infant is. So here they're asking about in what sequence we are going to check the vital signs in the newborn infant. And most important is here they are not asking you regarding CPR. Okay, they are only specifying regarding the vitals. So when checking the vitals in newborn especially, we have to follow the sequence like first you have to see for respiration. Then followed with pulse, and finally you are going to check the temperature. So BP is again not included in the newborn vitals. So these are the three important and in sequence we have to check. So let's move on to the options here. First, in first option they have given like temperature, pulse and respiration. Second is pulse, respiration and temperature. If you see the third option, here it is written as respiration, pulse and temperature. So this is the correct answer. So answer is C. So what happens if they are asking you CPR? In CPR, if they are asking you the sequence, then you have to write the sequence as TABC. Okay. In TABC, you will write like it is temperature, airway, breathing, and circulation. So this will be for CPR, which is TABC. But if they are asking you the vital signs, you have to choose option C, which is respiration, pulse, and temperature. So let's move on to the second question here. The mineral element which is essential for synthesis of thyroxine. Okay, so which is important for the synthesis of thyroxine? Here are the options. Option A, iron. Option B, iodine. Option C, sodium. And option D, chlorine. We all know that for the thyroid gland, iodine is very important, essential element. Okay, so if at all there is any deficiency in iodine, we are going to see some of the conditions called. I'll just write you few conditions. First is goiter. So what is goiter? Which is nothing but enlargement of thyroid gland. Enlargement of thyroid gland. Sometimes we can see a condition called hypothyroidism. Hypothyroidism is nothing but underactive thyroid gland. Underactive thyroid gland. The next important condition is cretinism. If you see cretinism, it is nothing but a condition which is causing irreversible mental and physical impairment in children. Okay, these are the three conditions which we are going to see in case of iodine deficiency. Because of this deficiency only, the thyroid gland undergoes so many changes. So that's why the essential element which is needed for the synthesis of thyroxine will be iodine. So the answer is B. So you can even quickly note down what happens in goiter, what happens in hypothyroidism, and what happens in cretinism. So next question is the neonatal reflex elicited by touching the cheeks of the baby. So when we are touching the cheeks of the baby will turn to one side. Okay, turning to side of stimuli. This reflex is called as rooting reflex. Okay, so whenever we are touching the child or on the cheeks, the child will turn to side of the stimuli. So that is rooting reflex. So answer is C. And you should know what happens in Moro reflex. Okay, the other name for Moro reflex is startle reflex. Moro reflex or startle reflex. Suckling reflex is nothing but whenever the child is put on to the breastfeeding, the child will suck the nipple and try to get the milk. So that is the suckling reflex. If you see the Moro reflex, there is another name for it which is called startle reflex. In this reflex, a newborn will get startled and fling out the arms when they they are falling. Feel like they are falling. Okay, so when we act like we are dropping the child from one distance from certain height or even on the cradle, if you just give a jerk reflex, the child will instantly fling out the arms and they get startled. So that is the Moro reflex or starter reflex. So in this question they have asked you like by touching the cheeks of baby, the baby will turn to the side of stimuli. So what is this reflex called? The answer will be option D. Sorry, I have written C here. Option D is the answer, which is rooting reflex. So next question. Deficiency of which of the following vitamins causes pellagra? So they are asking you regarding the deficiency of the vitamins. So if at all there is deficiency of niacin, what happens? Deficiency of vitamin B12, what happens? For vitamin D and for folic acid, we have to see. So let's start from folic acid here. So you know that folic acid is very important to avoid any kind of congenital anomalies in children. So, but this is for pregnant. Okay. So generally, if there is deficiency, deficiency of folic acid, we are going to see a child or an adult having anemia. So that's why iron plus folic acid is recommended. Okay. So in deficiency of folic acid, we are going to see child or a patient with anemia. So the next option, vitamin D. Vitamin D deficiency causes rickets in children. Okay. Next, vitamin B12. B12 deficiency causes pernicious anemia. Okay. The niacin deficiency causes pellagra. So the right answer is option A. Okay. So let's move on to the next question here. Normal head circumference in a newborn. So if you see my videos in KNO Academy, you will know about the growth and development. So in that videos, we have specified regarding the normal values and age wise the changes happening in all the growth and development we have specified there. In this, I will just tell you the normal values, but if you wanted to know the complete growth and development, kindly check out in that KNO Academy. Head circumference in a normal newborn will be 33 to 35 centimeters. So answer is B. Next question. Clay colored stool is suggestive of which disease? So let's see what happens in these four diseases. First, we'll take diarrhea. So if you take uh, typhoid, you're going to see mainly diarrhea in the child. The diarrhea is again described as pea soup diarrhea. In typhoid, which will be like foul smelling and green to yellow color liquid. So that happens in typhoid. Stool consistency, in all these conditions we will see. Firstly, in typhoid, diarrhea will be the symptom, and that too we call it as pea soup diarrhea in typhoid. So next, obstructive jaundice. In obstructive jaundice, you are going to see clay colored stool, or we can even call it as pale colored stool. Okay. So next option, ulcerative colitis. In ulcerative colitis, you are going to see blood or mucus in the stool. And if you take amoebic dysentery, you are going to see blood in stool. And dysentery, especially fresh blood. Okay, fresh blood in the stool. That we are going to see in amoebic dysentery. So in this question, they have asked you regarding the clay colored stool is suggestive of which disease, and the answer is option B, which is obstructive jaundice. So let's move on to the next question. What is the effect of cyclosporin in a patient undergone renal transplantation? Here they have asked you again about the action of cyclosporin on the patient with renal transplantation. So let's see the options here. First is anti-inflammatory. Of course, the cyclosporin is an anti-inflammatory, but in this case, it is not the main action. The second is immunosuppressant. Third is antibacterial, and fourth is diuretic. Okay, so the main thing what we have to remember whenever there is an organ or bone transplant, the main drug of action or the important measures we have to follow is to have immunosuppressants. Why we need this immunosuppressants is nothing but mainly they act on T cells, thereby prolonging the survival of organ or bone marrow transplant. So the action of cyclosporin here is immunosuppressant. It is not anti-inflammatory, it is not antibacterial, and not even diuretic. So answer is B. Let's see the next question. Causative agent of mumps. So first they have given you options like Toga virus, and H influenza, Haemophilus influenza. Third is paramyxovirus, and fourth is Bordetella. Let's see what is caused by Toga virus. So Toga is generally a RNA virus which mainly leads to encephalitis, arthritis, and fever. Haemophilus influenza mainly causes meningitis, epiglottitis, importantly pneumonia in children. So let's see the third option. Paramyxovirus usually causes mumps. Bordetella causes whooping cough, which we call it as pertussis. Okay, so here the answer is option C. It is not Toga or Haemophilus influenza or Bordetella. It is paramyxovirus. It is causing mumps. Whooping cough is caused by Bordetella. Meningitis is caused by Haemophilus influenza. Meningitis and pneumonia as well. In Toga virus might cause encephalitis, arthritis, and fever. Okay. So let's see the next question here. The client has an order for ferrous sulfate liquid. Which method of administration would be best? If you know about ferrous sulfate, which is nothing but iron supplement. Okay. So they are asking you which is the best method to administer the iron. First option is administer the medication with milk. Then second option is administer the medication with a meal. Third option is administer the medication with orange juice. Next option, administer the medication undiluted. So usually this iron supplements is better absorbed if you want good absorption. Okay, for good absorption of iron, we need to mix with vitamin C. So is there anything related to vitamin C? Just check the options and then you can go for that option. Why? Because iron is always given with vitamin C. So here the option is C here. Administer the medication with orange juice. So that is the answer. It is not about the meal or milk or dilution. It is with what liquids we are going to give the iron. Preferably we have to give it with vitamin C. Answer is C. Next question. Which information obtained from the visit to a client with hemophilia would cause the most concern? So we should know what happens to a hemophilia patient and which is like needing most concern here. They have given you options like likes to play football. Option B is drinks several carbonated drinks per day. Option C has two sisters with sickle cell trait. And option D is taking acetaminophen to control pain. So if you see hemophilia patient, usually in hemophilia patient, we have to avoid injury. Avoid the injury. Why we need to avoid injury is to prevent bleeding. Second thing is you need to even avoid medications, which is going to affect the blood clotting. Okay, these are the two important measures that we need to take in case of hemophilia patient. First thing is avoid injury. Second is to avoid the medication that is going to affect the blood clotting. So now we'll see the options. Injury causing games we should avoid, especially like football. Okay, so that is again a good point. Second is drink several carbonated drinks. Here, nothing to do with carbonated drinks, increasing sugar levels and all, nothing going to affect the hemophilia patient. And having a sickling trait also, it is not affecting the main patient. The fourth is taking acetaminophen to control the pain. Mostly they need to avoid, but it is not a very important concern. Still, that is a good option, but if you don't have the first option, you can opt for D. But if they have given you playing football or vigorous activities, so then the right answer will be option A only. If you don't have A option, then you can opt for D because I have told you 2 points. First point is avoid the injury. Second point is avoiding the medications that is going to affect the blood clotting. So here the optimal answer is A. Okay. So let's move on to the next question. All of the following are components of Apgar's code except. So except you always sometimes we will be forgetting the except option. We will be thinking which is the correct option in the given below. But we have to always reread the question for at least 2 times. Okay, then you can see for the options. They have asked you regarding the except point. So let's know what happens in Apgar. Okay, A is nothing but appearance. In appearance, you are going to see skin color. Okay, next is pulse. Third option G is nothing but grimace. Reflex irritability, we are going to check. Again, A. In this A, you are going to check the activity where muscle tone can be assessed. Final option is respiration. Okay, so this is Apgar. Now let's check the options given below. First option, color. So in appearance, you are going to check the color. So color is a component only. Second is heart rate, where again it is called as pulse rate. So this is also a component of Apgar. Third option, respiratory rate. If they have given you only respiration, then that would be a correct answer. But if they had given you respiratory rate if they had given, that is not a component. In Apgar, you are going to check just respiration is present or not. If there is present, you are going to give the points. If they are not present, you make it as 0. Okay. So respiratory rate is not a component of Apgar. Muscle tone, grimace, I mean the activity you are going to check. So that is also a component of Apgar. So the right answer here is respiratory rate. Rate is not a component of Apgar. So answer is C. So let's see the next question here. So in this question, which of the following pathogen causes maximum death due to diarrhea in children less than 5 years of age? So they have asked you the cause for deaths due to diarrhea, and that too maximum. Okay, they have asked you maximum deaths which is happening due to diarrhea in children, especially less than 5 years old. Options are like Norwalk virus, second is rotavirus, third is Clostridium difficile, and fourth is Shigella. So we know that rotavirus is the vaccine which we are giving to control the deaths due to diarrhea in children. Option is the right answer is B. So let's see about the rotavirus vaccination. We have vaccines of two types. First is Rotatec and second is Rotarix. Rotarix is RV5 type and Rotarix is RV1 type. This has 3 doses, 2, 4, 6 months of each. 3 doses. But Rotarix is having only 2 doses at 2 and 4 months of each. So this vaccination is very, very important. They might ask you what happens in Rotarix and what happens in Rotarix. How many are the vaccines and which type it is. Okay, RV5 and RV1, they might ask you. So that is about the rotavirus. This is the main pathogen which is causing maximum death due to diarrhea in children. So we'll see the next question. Nurse is preparing to care for a child with tonsillectomy. So here is the question. After tonsillectomy, the nurse should suggest which position? So if you see a tonsillectomy patient, always they have to lie down in side lying or lateral position. Sometimes they will ask you even lateral position, or sometimes directly they will give you side lying position. Answer is B here. I'll tell you why it is very important again. Okay. Usually this side lying position improves airway patency and breathing after tonsillectomy. It is even reducing, it even reduces risk of choking or risk of oozing from surgical site. Okay. The important measures, what we have to see is regularly, okay, regularly check for surgical site. Okay, why we need to check the surgical site so regularly is sometimes we might not observe there is soakage in the dressing. If soakage is present, definitely there is some issue with the sutures or the position because there is more oozing from the surgical site. Okay, so this is very important point here. In this question, they have asked you which position is recommended for a child with tonsillectomy surgery. The option is side lying. Option B. So let's see the next question. Excess of vitamin K in newborn is going to cause which problem? Options are like bleeding tendency. Second option is hyperbilirubinemia. And third option is vomiting. And fourth option is diarrhea. So for newborn, after birth, vitamin K is given. Why we are giving is because to avoid bleeding problems. Okay, but if you are overdosing it, again it is an issue. Overdose. Overdose causes jaundice, which is the other name for hyperbilirubinemia. Hyperbilirubinemia. Sometimes it is causing hemolytic anemia. And last option is kernicterus. Okay, brain damage. These are the common situations which you are going to see because of overdosage. First thing is jaundice, second is hemolytic anemia, and third is kernicterus. If you are getting these three options and fourth option is all the above, you can write all the above also. Sometimes they might give you hemolytic anemia Again, it's a correct answer. Kernicterus is also a correct answer. Okay. But in this option, they have specified you only hyperbilirubinemia. So that is the right answer. So the answer is option B. So let's see the next question here. Kwashiorkor is diagnosed in growth retarded children along with. So what is the other important symptoms that you are going to see in Kwashiorkor? So this is nothing but in Kwashiorkor you are going to see it is a first of all it is a malnourishment. Seen in malnutrition, but preferably they will be having edema and hypopigmentation. So why these two features are there, I will tell you. Edema is because of fluid retention. Fluid retention is because of low levels of albumin and protein. Okay, so that is why we are going to see edema, pedal edema, edema over anasarca, what we call generalized body edema, everything is seen. But edema is happening because of fluid retention. That fluid retention is happening just because of low levels of albumin and protein in the body. So edema is one such important feature in kwashiorkor. The second feature is hypopigmentation. If you see hypopigmentation, which is nothing but dry, brittle, and depigmented, patchy skin areas. So easily the child skin will get dry and the pigmentation is not evenly distributed. Okay, so these are the two main features that you are going to see in kwashiorkor child. First is edema and second option is hypopigmentation. Here the answer is C. So let's move on to the next question. Most common cause of meningoencephalitis in children. They have asked you most like meningoencephalitis. Here are the options. First option is HSV, second option is measles, third is arbovirus, and fourth is enterovirus. The most common cause is enterovirus. Okay, but let's see what are the other options here. HSV, they have told. HSV mainly causes encephalitis only. Only encephalitis. It is not meningoencephalitis. Okay. Enterovirus and herpes. These two are going to cause meningoencephalitis, not arbo or measles. Okay. So the right option here is enterovirus. Option D. The next question here is the appropriate approach to neonate presenting with vaginal bleeding on day 4 of life. So commonly, whenever we see such kind of question, we will think like there is bleeding manifestation. So what you're going to do? Sometimes they will give you options like give vitamin K or send for some investigations, do nothing or give FFP. These are the options given here. Blindly, by seeing the vaginal bleed, we are not going to select the options here. Let's see what happens for a neonate at day 4 of life. On day 4. Okay. Especially in a female neonate, what we are going to see. Usually they have vaginal bleed. Okay. It is a normal. normal thing to happen from 3 to 7 days of life. It is normal. Why it is occurring is it occurs due to withdrawal of maternal hormones. It usually subsides within 2 to 3 days. So no any specific treatment is required. If it is prolonged, then seek medical advice. Okay, so this is about the vaginal bleed. So usually it is normal for a female neonate to get vaginal bleed from 3 to 7 days of life, and that will automatically subside within 2 to 3 days. Okay, so there is no any specific treatment required, but still you have to be very cautious. If it is like prolonged bleeding, continuous bleeding, and if it is like for a month and all, then definitely we have to seek medical attention, but otherwise only on day 4 it is not much required. Okay, the options here are administer vitamin K already we have given at birth, so again no need to give. Okay, again excess of vitamin K will lead to jaundice and all, so no need to give. Investigations of bleeding disorders, again not required. No specific therapy is the right answer. So the answer is C. Giving FFP will be like again a wrong answer, because that will go for severe blood loss. Okay, in severe blood loss, you can give FFP, but otherwise, that is not a right answer. Right answer is C. So let's see the next question here. Which of the following is the principal mode of heat exchange in an infant incubator? They have asked you only about incubator, not about remaining aspects. So in incubator, the right answer is convection. Answer is convection. I'll tell you why it is convection. In convection, heat is transferred by movement of air or gas. If you see conduction, it is direct contact with heating elements. Surface chambers. Surface inside the chambers. Radiation is nothing but without the radiation is again from low to high. The energies will be passing. This is not happening in incubator. Evaporation, involuntarily water loss will be happening to the newborn. So that will be evaporation. Again, that is not happening in incubator. In incubator, just convection. Why? Because if you see incubator, suppose this is a box, okay, and this is the newborn, you think. If in this incubator, if you are placing the child inside, heat will be transferred through exchange of gas, like this. Uniformly the heat will be exchanged, so that is called convection. We are going to see it in incubator, so the right answer is C. So next question, increase in length in first year of life. They are asking you only the percentage, so how much will be the length increased by first year of life? The answer is B, 50%. In detail, if you need to know about the growth and development, kindly check out the videos regarding growth and development in KNO Academy. Otherwise, here again, it will be a elongated process to detailedly describing about it. Just you need to know increase in length in first year of life. Percentage will be definitely 50%. So let's see the next question. Next question here is, which of the following diet instructions should be given to the client with recurring UTI? Okay, so for the UTI patient, what diet instructions we have to give? Here are the options. Increased intake of meat. Meat is going to give excess heat, so we have to avoid such kind of food items. Second is avoid citrus. Citrus fruits, vitamin C is good, but they told to avoid, and this is not an answer. Perform perineal care with hydrogen peroxide. Only this happens due to infections, like severe infections, but here again we are not going to do such kind of activities. Drink a glass of cranberry juice every day. Cranberry juice, vitamin C. So giving vitamin C will reduce the symptoms in recurrent UTI. So the right answer here is option D. So you have to give vitamin C to the patient with UTI. So C for that kind of, sorry, here I have written D. It's not C, it's D actually. Right answer is D. So let's move on to the next question here. What is the primary purpose of administering corticosteroids to the child with nephrotic syndrome? So in nephrotic syndrome, we are going to administer corticosteroids just for the purpose of protein loss to be prevented. So that's why we are giving the corticosteroids. You are going to see proteinuria as a main clinical feature in nephrotic syndrome. That's why we are going to give corticosteroids to avoid the protein loss. Let's see the options. To increase BP. Already they will have high BP. Okay. Again, we need not increase BP here. To prevent infections, no, it is not because of that. To decrease proteinuria is the right answer. So the right answer is option C. So let's see the next question here. Deficit in weight for height in a 3-year-old infant. They have asked you regarding the weight for height. Okay, so what happens if there is no proper weight for height? Options they have given you is acute malnutrition, second is chronic malnutrition, and third is concomitant acute and chronic, like both. Fourth is underweight. So if you see weight is not appropriate for height, definitely this will lead to recent, okay, recent and severe weight loss. Recent, if they are telling you, the answer for that is acute. Okay, recent and severe weight loss. So the answer is option A. We're going to see acute malnutrition in the child who is having deficit in weight for height in a 3-year-old. So let's see about few important points here. Less weight for age. We call it as stunting. Okay. And less weight for height. We call it as wasting. Sometimes they might even ask you what is less weight for age. That is stunting. Less weight for height, we call it as wasting. Here the right answer is option A. Let's move to the next question. Earliest sign of pathological gastroesophageal reflux in infants. Pathological gastroesophageal reflux. So let's know about the GERD. So GERD, if you see, this is of two types: physiological and pathological. In physiological, so regurgitation will be present. Regurgitation will be present after the feed. but still weight gain is present. Weight gain is present, no respiratory problems. No respiratory symptoms that you are going to see in physiological GERD. Next, we will take pathological GERD. In pathological GERD, you are going to see regurgitation is associated. Regurgitation is associated with refusal of feed. So, excess vomiting will be there. Weight loss will be there. Failure to thrive will be there. So, they will have in pathological we were discussing now weight loss is present, excess vomiting will be there, respiratory problems also there. Respiratory problems, main problem why? Because they will be having wheeze, they'll be having stridor, cough. You can even see aspiration, sore throat, hoarseness of voice, and recurrent pneumonia. In this pathological, most frequent complication, if you see, that will be failure to thrive. And next option will be recurrent respiratory symptoms. So this is all about the pathological GERD. I told you in physiological GERD, regurgitation there, but weight gain will be there, no kind of respiratory problems. But if you see pathological, in pathological weight loss is there, okay, excess vomiting will be there, all kind of respiratory problems will be there, mainly recurrent pneumonia. This is going to kill them. Okay, so these are, all these are the main important features. But if at all they, in some questions they might ask you what is the most frequent complication that you're going to see in pathological GERD. Options will be like failure to thrive or recurrent respiratory symptoms. So let's see the options here. Upper GI bleeding is nothing to do here. Okay, they have I have not told you regarding any GI bleeding. Respiratory problems, yes, it's a major concern. Esophageal strictures are not there. Postprandial regurgitations are not there. So the right option here is respiratory symptoms. So answer is B. Okay. So let's move on to the next question here. Most common cause of neonatal sepsis in hospitals in India. Okay. So neonatal sepsis. The right answer is E. coli. Okay. In India, if they are asking you, answer is E. coli. And worldwide, if they are asking you, the answer is Klebsiella. Okay. Answer is A. They just asked you the most common causative agent of neonatal sepsis, and especially in India. In India, it is E. coli, but in worldwide, if they are asking you, you can opt the option called Klebsiella. So let's see the next question. A 2-year-old child is admitted for traction to support the fracture to treat congenital hip dislocation. The nurse anticipates using which traction system? So you let's quickly see what kind of tractions we can use here. Bryant traction, Buck's extension traction, Halo traction, and Hamilton traction. So Bryant traction is mainly used for developmental or congenital dislocation of hip. Buck's extension traction is used for hip or femur fracture. And if you take the halo traction, spine related fractures. Fourth is Hamilton. Hamilton is used for femur or acetabulum fractures. Now you can guess the right answer for this. The answer is Bryant traction. Answer is A. So, next question. The nurse is preventing which type of heat loss by wrapping the neonate in a blanket? So, covering neonate with blanket. Covering neonate with warm blanket. By covering the neonate with warm blanket, we are going to see to prevent the conductive heat loss. Suppose if you are placing the neonate uncovered and directly you are placing them on a bed or a warmer, they are going to have conductive heat loss from the body of neonate. The heat is getting transferred to the warmer or the outer surface so that there will be heat loss. Okay, the right answer is option D. Answer is D. So let's see the next question. What is the Cushing triad of intracranial pressure? So this first we need to know the triad symptoms of ICP. Triad symptoms includes widened pulse pressure. In widened pulse pressure, you are going to see increased systolic BP and decreased diastolic BP. Okay, that is the first one. Second one will be bradycardia, and third will be bradypnea. Now you can choose the right answer here. Definitely, there is no tachycardia, okay, and there is no hypotension. So the right answer is option C. Answer is C. Widened pulse pressure leads to high BP, bradycardia, and bradypnea. So hypertension, bradycardia, bradypnea is seen in option C. So let's see the next question. A 3-year-old boy with normal developmental milestones. Okay, but still he had delayed speech and difficulty in communication and concentration. So this is the hint what they have given you. So he's not even making friends. So what problem he is having? Okay, the probable diagnosis. If there is a problem in speech, communication, okay, or difficulty in forming relationship, difficulty in forming relationship, This leads to a condition called autism or some spectrum disorder, autistic spectrum disorder. But here they have clearly told you he don't have proper speech, he don't have proper communication, don't have proper concentration, and he is not even making friends. So it is not ADHD because they are hyperactive, mental retardation, no specific learning disability, but they have even told you regarding communication. So this is also a not right answer. The right answer is option A. Answer is A. Autism. So the next question here, the important fatty acid which is present in breast milk, which is important for the growth of the child. So they have asked you the type of fatty acid which is important for the child growth. Mainly in breast milk, you're going to see two important fatty acids. One is DHA and second is EPA. So DHA is nothing but docosahexaenoic acid and EPA is nothing but eicosapentanoic acid. Eicosapentanoic acid is EPA. DHA is docosahexaenoic acid. So these two are the important fatty acids present in breast milk, important for the growth of the child. So the right answer here is option A. Palmitic, linolenic, linolic. So these are not the correct option. The answer is A. So the last question in this session is the best indicator for nutritional status of a child. So how to find out the nutritional status of a child is mainly you have to check the height for age. So height should be there. Okay, apart from weight. Weight is secondary. Okay, height will be primary. So height for age is the important option. So let's see the options given here. Mid-arm circumference, no. Head circumference, no. Chest circumference, no. But the rate of increase of height and weight. Weight is secondary. They gave you as a secondary option. The primary option what they have given you is height. So the right answer is C. So in this session, I have discussed about few important MCQs here. We'll see the much more MCQs in the next coming sessions. I hope you understood this video. Let's see in the next sessions. Thank you.